us know pain, have experienced its agony. Thankfully, most pain is momentary. It passes. The nearest most of us have come to lasting pain is when a tooth or an ear aches. Yet those pains, though seemingly endless, are still temporary. With treatment, pain goes away. There is another kind of pain, much more severe, that never sleeps, searing, soul-destroying. Chronic pain. It is cancer pain. Yet even pain of this intensity can be treated and managed. Far too many patients, families of patients, and even doctors and nurses are unaware of the simple fact that there are drugs and a method to bring relief to cancer patients. From Geneva, the World Health Organization leads the fight to give cancer patients freedom from their pain. According to WHO, more than 3.5 million suffer worldwide. In addition, every year cancer claims 6 million new victims. The vast majority of all cancer patients need pain relief.
Nothing would have greater impact globally on cancer than to apply the enormous knowledge we have gained in cancer. We know very much. To prevent at least a third of all cancers, to cure at least a third of all cancers, provided we diagnose them in time, and to offer pain relief and death in dignity to the remaining.
Even in the industrialized world, not all cancer patients are adequately treated for pain. Contrary to popular belief, cancer is a problem of the third world as well. More than half of the world's cancer patients are in the developing countries. Most of them are incurable at the time of diagnosis, and many suffer pain. Very few receive pain relief. Dr. Pamela Sutton, WHO consultant in India.
80% of patients are rural, and by the time that they get across the difficult, long distances, recognize they have a problem, and get help for their problem, they may have advanced disease. So if 80% of the patients have advanced disease at diagnosis, then pain is a big problem. It's been estimated that 70% of cancer patients who have advanced disease have significant pain sometime in the course of their illness.
Yet little is done to alleviate pain, because there's widespread inadequacy of medical education in cancer pain therapy. Medical students are taught to treat cancer, not to treat pain.
As a cancer specialist in Sweden, I didn't get a single hour of cancer pain relief training.
Little is done to relieve cancer pain because of an inadequate supply of drugs, particularly morphine and other opiates. A major obstacle is national legislation that limits the availability of the drugs. The areas shaded are where morphine is virtually unavailable or difficult to obtain. Little is done because of a lack of awareness by patients and by their families that pain can be managed. In most cases, patients suffer without complaint. At the Memorial Sloan Kettering Cancer Center in New York City, Dr. Kathleen Foley, chief of the pain service.
There are some people that think that patients don't have the pain they say they have. They don't believe the patients. There are some who think that pain's good for you, so rough it through.
Little is done because of a lack of support by many governments. At the Tanzania Tumor Center, the director, Dr. Jeff Luanda.
We've had some problems getting pain drugs into our institutions, mainly because of, the major reason is foreign exchange and availability, so we don't buy enough of all the drugs that we require. What we use now, if we can't palliate the patient with radiotherapy, we put them on analgesics, and the ones we've used typically are aspirin and paracetamol.
Little is done because of the fear of drug addiction. Doctors tend to underprescribe and nurses to underdose.
Some doctors and nurses can be horrified when they hear that a patient is receiving 100 to 200 milligrams of morphine. That sounds just awful.
Pain can be controlled through a handful of drugs. Together with leading international experts, WHO has developed guidelines for the management of cancer pain. It is a relatively simple and inexpensive method. It is essential, however, to learn how to use these drugs well. Immediately when there is pain, administer drugs, that is, with aspirin or paracetamol. If pain persists or increases, then switch to a weak opiate, as, for instance, codeine. And if the pain still persists, then go to a strong opiate, such as morphine, until freedom from cancer pain is achieved. These drugs are on the WHO essential drug list, which means that most governments have pledged to make them available for their citizens. To calm fears or anxiety, additional drugs called adjuvants are used. In addition, administer the drugs by mouth and by the clock. For example, give them every 4 hours, not on demand, that is only when there is pain. WHO three-step ladder was proven effective by Dr. Fumikazu Takeda of the Saitama Cancer Center in Japan. His study shows that 87% of patients ultimately became pain-free. Other studies as well demonstrated that the right drug, in the right dose, given at the right time, relieves 80 to 90% of cancer pain. One of the right drugs is oral morphine. In the eyes of the public, patients and even some professionals, doctors, nurses and pharmacists, morphine is a fearful word. Morphine connotes addiction and crime. However, it is exceedingly rare for cancer patients receiving morphine to develop addiction. The world of the cancer patient is not that of a drug addict. Listen here to the wife of a cancer victim.
There was times when if you could buy street drugs, you probably would. And you don't know the quality, the dosage or anything, but you are up against the wall. There's only one other way out, and that's suicide. The morning after he got this first prescription, it was the first night he slept through for many, many months.
Listen now to the testimony of a cancer patient taking oral morphine.
I take 180 milligrams once every 8th hour of the day. In other words, I go around the clock, so I take the dose at 6 in the morning, at 2 in the afternoon, and at 10 o'clock at night, which is very, very good spacing for me because it does not interfere with my sleep between, let's say, 10 in the evening and 6 in the morning.
I'm an advocate of teaching patients about pain, teaching them what their choices are, what their options are, and how the drugs work. And it's impressive to see how good they can become at treating their own pain. It's also impressive to see that they don't abuse the drugs. They don't sell them on the streets of New York. They don't take the drugs and overdose themselves with it. And they have enormous respect for the drug, but they also have learned to use it effectively.
The challenge before us is to act now. WHO calls for nurses and doctors to increase awareness that pain can be managed, educators to train health professionals in cancer pain therapy, legislators to make the drugs accessible to cancer patients, patients and families to demand medication as a right, and, above all, there is a need for government health services to commit themselves to a policy of cancer pain relief. In many countries, in all continents, there's a growing awareness that pain from cancer can be managed. The governments of Canada, France, Sweden, and India have adopted clear policies on cancer pain relief. Nurses play a leading role in providing pain relief. For example, in Sweden, nurse Elisabeth Schillander is a member of the pain control team at Linköping's hospital. Nurses are better placed than the doctors to sense their patients' needs. They represent both sympathy and empathy to patients. In India, as well as other countries, the laws are changing. Dr. Mohan Bhatia of the Gujarat Cancer Research Institute can now, for the first time, provide his patients with oral morphine. In the United States, a coalition of concerned citizens and health professionals in Wisconsin is spreading the message that cancer pain should not be tolerated. This initiative is now spilling over to other states. In addition, WHO is constructing a network of individuals and institutions to disseminate knowledge of what can be done to relieve pain. The Cancer Pain Relief Book, containing the principles of the WHO three-step ladder for pain relief, is another example of progress. Out of popular demand, it has been translated into more than 10 languages. Pain relief allows cancer patients to function normally. It is a humane, pragmatic, realistic way to ease tremendous suffering. Patients must be cared for so that they're able, under the supervision of hospital staff, to spend more days at home, leading as normal a life as possible.
I think what we do is really important, because what we do for those patients is that we provide them with the ability to live their lives and to die in a way that is probably the most humane, but also for them personally at the highest level.
And the only way to restore the quality of life for a great number of cancer patients is to offer cancer pain relief and active supportive care.
There is a moral imperative to act. Those in pain just can't wait.
Everything's going my way. All the cattle are standing like statues. All the cattle are standing like statues. They don't turn their heads as they see me ride by. But a little brown maverick is winking our eye. Oh, what a beautiful morning. Oh, what a beautiful day. I got a beautiful feeling. Everything's going my way.